Well, one of the ways the world has changed is, I think, despite all our grumblings about the evils of globalization and the losers in globalization, one inescapable fact is that there's been tremendous economic progress globally. China, of course, is responsible for some of that. India, other countries are responsible for some of that. But the proportion of countries that are labeled as low income in the globe has shrunk dramatically. And what that does is it changes the possibilities for those people, not just for the education of their children and hunger and poverty, but also for health. The first domain of health challenges these high rates of avertable, and I really want to stress avertable, infectious child and maternal deaths. We call this the unfinished agenda. Should have been long finished, it's not finished. Second is there is an emerging agenda on global health, which has to do with the demographic changes and shifts in the global burden of disease towards non-communicable diseases and injuries, and apologies for those acronyms up there. But again, many of those trends have already been described by previous speakers. And finally, there is also a cost agenda or an economic agenda, which is this. Not only is impoverishment bad for your health, but getting healthcare can impoverish you. So the notion that people are actually spending tremendous sums of money, sometimes money they can't really afford, to access healthcare. It's a hugely valuable service for people all around the globe, and it is impoverishing people, not just in Africa, but right here in the US. How do we get to the Global Health 2035 goals? One of the key mechanisms is that we do have to insure everyone against the cost of illness, as well as promoting and promoting good health and preventing disease. And universal health coverage is really the idea that we pool resources between rich and poor and get people insured so that when they do get ill, they're able to obtain the care they need.